the reproductive organs in a woman, the one responsible for producing eggs. Okay, so the same eggs that does get fertilized by the sperm and eventually, if successful, results in a pregnancy and eventually birth of a life baby. So that organ responsible for producing the eggs in the woman, that is the ovary. So cancer involving the ovary is ovarian cancer.
Right. So how common is this kind of cancer?
Yeah, it's relatively common among gynecologic cancers. By gynecologic cancers, I mean cancers occurring in women. Top amongst them is cervical cancer, followed by uterine, and then ovarian is next. So it's that common.
Right. And for those who might not really know, what's the difference between cervical cancer and ovarian cancer? Because, like you said, both of them are from the reproductive part of the woman.
Yeah, so for cervical cancer, it's cancer of the, in layman terms, mouth of the womb, okay? So, but the ovarian cancer is cancer arising from the ovary, the place where the eggs are produced. So cervical cancer is the commonest gynecologic cancer here in Nigeria.
All right. Well, so to put it in perspective, in terms of how common it is, I just need to give me some prevalence rates that we have. So if we have 10 women in a room, how many of them are likely to come down with ovarian cancer?
Okay, so for ovarian cancer, the average lifetime is speaking generally now is about 1 in 70. And the median age of diagnosis is 63 years. So like 1 in 70 women have a lifetime risk of coming down with ovarian cancer.
Right.
So if there are like 10 women, like you say, in a room, so maybe like 1 or 2 of them, it's not so common, at least not in this environment. It's more common in Caucasians.
So it's more common with Africans? Is that it?
No, it is more common in the whites.
Okay.
In Caucasians.
Right.
In whites, yeah.
Okay.
Yeah.
All right. So a lot of times we always look at causes and effects of things and concepts in life. And I know in medicine, you guys, you really talk on causes. So, but what are the risk factors?
Yeah, so for ovarian cancer, the risk factors can broadly classify them. We start with the reproductive risk factors. Okay, so the risk factors that can decrease the risk or associated with a decreased risk of ovarian cancer include 1 or more pregnancies or births. So, and usually the cutoff age for this is 35 years. So a woman who has had a child before the age of 35 is less likely to come down with ovarian cancer than one first childbirth or first pregnancy happens after the age of 35.
Oh.
Also, use of...
No, let's get clarity to that. So you're saying now that any woman who has a delayed birth, for instance, anyone from age 35 upwards, might likely come down with ovarian cancer. Is that it?
Yes. If you're having your first child after the age of 35, you have more risk for coming down with ovarian cancer than somebody who has had a first child before the age of 35 years.
Why is that cancer discriminatory?
It's just it's the estrogen levels really. So for someone who has delayed childbirth till after 35, the interplay between the hormones, because the ovaries produce hormones, the interplay between the hormones, the ovaries produce a lot of estrogens. So usually there's a cyclical change that's happening in a woman that results in menstruation. So
right.
Cyclical change between levels of estrogen, levels of progesterone. So once a woman gets pregnant, okay, so that cyclical change, it's put on a hold, so to speak. So the ovaries are resting while she's pregnant. So, but if, it's been exposed all the while, so that does put the woman at more risk of coming down with ovarian cancer. And same goes for a woman who starts menstruating early. So a child who starts menstruating early, say before the age of 12, compared to a child who starts menstruating after 12 years, is more at risk for coming down with ovarian cancer.
Wow.
Same applies to a woman who stops seeing her period, later than someone who stops earlier. So a woman who stops seeing her period, say like 55, compared to one who stops seeing her period like 48 years, is more at risk for coming down. So basically that estrogen window being the period where you're fertile, you start seeing your period, and the period between when you start seeing your period and when you stop seeing your period. So the longer it is, the more at risk for coming down with ovarian cancer you are.
And Dr. Shikolu, these are natural phenomena. I mean, there's nothing one can do about that.
Oh yes, there's nothing we can do about that. Yes, you're right. So another risk factor is use of oral contraceptives. So women who use oral contraceptives, it is actually protective. Use of oral contraception decreases your risk of coming down with ovarian cancer. Another one is breastfeeding. Breastfeeding also decreases your risk of coming down with ovarian cancer.
Oh.
So, and the time limit for that is breastfeeding at least 6 months. Less than 6 months is not necessarily protective.
Oh, good.
So the longer you breastfeed, the more protection you get against ovarian cancer.
Right. So on the one hand,
factors which increase.
Yes.
Yeah, go on.
So I'm trying to say, on the one hand, we have factors that could increase your likelihood of contracting it, but on the other hand, you also have ways that you can mitigate it. That's what it means.
Oh yeah.
Let's touch down on the symptoms now. So what are the signs that would show a woman that she is coming down with ovarian cancer?
Yeah, sadly, ovarian cancer in the early stages is what we call asymptomatic. No signs, no symptoms in the early stages. Okay. So, but when it's advanced, and sadly, the case, most women with ovarian cancer, they come when it's advanced. So, when it's advanced is when we start seeing symptoms. So, symptoms you find are symptoms like what we call easy satiety. You know, you get full very easily. You just eat little amount of food and you're like, oh, I'm full. You know, so other symptoms could be like some bloating. You feel bloated.
Okay.
So and sometimes too, if you start experiencing frequent urination, you know, you're someone who before you don't have any issues with urinating so often, and all of a sudden you start urinating so often, and it comes up most days of the month, say more than 12 days in a month, and you can't really attribute this to anything else, any other benign condition or any other malignant condition, then you probably need to check out if there's anything going on in your ovaries, like ovarian cancer.
Right.
So so those are some of the symptoms that you would experience. Or generally pressure symptoms, sometimes to constipation, you know, you just get constipated, you are eating all the fibers, you know, your diet is good, high in fiber, and everything else that contributes to your bowel output on point, but you're still constipated. Then you need to check it out.
So there's nothing like bleeding from the reproductive part?
Yeah, sometimes, very rarely you could have some women bleed from ovarian cancer. The bleeding part is more from, you know, cervical cancer or endometrial cancer. And as a matter of fact, if the woman is presenting with bleeding and the pointers are pointing towards ovarian cancer, it is advisable that she does get an endometrial biopsy just to rule out the fact that the ovarian cancer may have spread through the endometrium. So bleeding is not so common in ovarian cancer, but it can occur.
Right. So is ovarian cancer easily diagnosed?
Yeah. So easily diagnosed. If we want to talk about screening, it's not something that can be easily screened for. Okay. So, but some measures that can be adopted for screening ovarian cancer can be doing what we call a transvaginal ultrasound scan. Transvaginal ultrasound scan meaning that the probe is put into the woman's vagina as opposed to being placed on the abdomen. So the transvaginal ultrasound scan is better for helping with diagnosing ovarian cancer than the transabdominal ultrasound scan. And also another test that can be done is a tumor marker that we call CA125. A tumor marker, by the way, is a chemical that the levels increase when there's cancer somewhere in the body. So we have different types of tumor markers for different types of cancers. So for ovarian cancer, the tumor marker concern of note is what we call cancer antigen 125.
Right.
So if a woman does the cancer antigen 125 and it is elevated, normal range is from 0 to 35. So if a woman does cancer antigen 125 and the level is above 35, it's up to 60, then that's more than double, or about double, then she needs to screen seriously for ovarian cancer.
Okay, so the big question on the minds of our listeners this morning will be, is it, I mean, like other cancers, you can walk into a facility now and say, look, let me do a screening for cervical cancer, let's check out there are lumps here in the breast, let's do some screening for prostate and all of that. Is it possible for that one to do that too? And how often can one do that for ovarian cancer?
Yeah, so most guidelines that we as oncologists work with in taking care of our cancer patients, they do not have any recommended screening measures for ovarian cancer. But like I said, if you have suspicion that you might have ovarian cancer, the test to do transvaginal ultrasound scan, and that can be available in most reputable diagnostic centers. You don't necessarily need to go to hospital for that. You can just walk into any reputable diagnostic center and ask to do a transvaginal ultrasound scan. And you can also ask to do the cancer antigen 125 blood test. That's the cancer antigen 125, by the way, it's a blood test. So they just take a blood sample from you and run the cancer antigen 125 test to know whether it is elevated or not. So these are the tests that you can do. And yes, they are available in reputable diagnostic centers.
All right, then Lagos Traffic Radio 96.1 FM. This morning, we are navigating the complexities of ovarian cancer, and we're learning a lot. Dr. Bukola Oshikolu is taking us to the classroom. She's a radiation and clinical oncologist with NSIA Youth Cancer Center. I have a very big question for her, but before then, there's one here coming in from one of our listeners. This one says, good morning, Dr. Bukola. Do you believe the government is doing enough to prioritize cancer care in Nigeria? Or Layemi from Ifako is sending that one in. So, add to what Olayemi have just asked, do we have enough care for cancer generally in Nigeria?
Yeah, in terms of facilities for cancer management, I would say the government is trying. We at the NSIA Youth Cancer Center, we're one center here in Nigeria, but other oncology centers are also coming up around the country. So yes, we may not be the ideal yet, or we may not be basically we may not be what every Nigerian will clamor for in terms of number of facilities. But yes, there are some facilities in cancer centers in Nigeria providing this care. So I would say the government is doing its best, but it can do better, especially in terms of funding for cancer care.
All right.
So having the facilities is one thing, and then having the funds to seek this treatment or seek care in these facilities is another ballgame entirely.
Right. Okay. So the big question is ovarian cancer curable?
Ovarian cancer, if it is detected in the early stage, it is very curable. If it is detected very early, it is curable. But in the advanced stages, no. Okay, for example, if it has spread already, because cancer diagnosis from any part of the body, it's a diagnosis or it's a disease that has the ability or propensity to spread. For example, ovarian cancer starts, and if it's not detected early, or even if it is detected early, treatment is not instituted early, it can spread. So once it spreads from the ovary to lungs or liver or any distant organs, at that point, it is not curable. Doesn't mean the patient can't receive treatment. There is treatment, but the treatment that would offer would be to improve the patient's quality of life, make the patient reduce symptoms as much as possible, and make the patient as comfortable as possible. Okay, so but if it is detected early when it hasn't spread, it's just still in the ovaries or in the adjoining fallopian tubes, then yes, it is curable.
All right, another question here says, good morning, Victor. Ovarian cancer is like a silent threat. Why is it so difficult to detect early? You didn't put your name, but thank you so much. Is that the way you refer to it, Dr. Shikonlu?
Yeah, so like I said, most patients with ovarian cancer, they come late, and that is because really the symptoms are non-specific. If you recall, I said earlier that we have symptoms like bloating, we have symptoms like early satiety. You know, an average doctor, when you go to an average doctor and complain of bloating or early satiety, they will be thinking more of disease coming from the gastrointestinal tract, perhaps the stomach, or somewhere up there in the gastrointestinal tract, as opposed to in one of the gynecologic organs. So that's why it poses that. So when the patients start complaining about this, you know, and go to an average doctor, they are looking somewhere else as opposed to looking to the ovaries, you know. But with a high index of suspicion, and if you are able to see somebody who is oncology oriented in his or her thinking, I mean a doctor who is oncology oriented, then they may be able to help out to send you to do a scan that may be able to pick up chemotherapy.
All right, then more questions
so
here.
That's why, yeah.
All right, more questions here. Says, good morning, Victor and Doctor. Please, are there any early warning signs that women, especially in their 30s and 40s, should not ignore? Bimbo is asking that question. Thank you so much, Bimbo.
So like I said, early warning signs are for ovarian cancer, when it is in the early stage, it is asymptomatic. I mean, it's just going in there. It won't give you any symptoms. It's when it's become advanced that you start seeing symptoms like early satiety, bloating, urinary frequency, constipation.